The cervical is different, and see it has a bifid spine, the body, and see the foramen transversarium. ठीक है जी, foramen transversarium. The vertebral, when you see it in this, you please today just see the mala, jopo mala, okay, mala jopo. God bless me, pass me out, pass me out. Okay, you have to see. No one will pass you if you don't identify. You cannot identify. See, I told you, you have to say the keywords, this thing, identification marks. You take a occipital bone. Okay, you have to foramen magnum को पहले बोल दो. It is seen in the posterior aspect. All the skull bones, they are parietal दो, temporal दो, maxilla दो, frontal single, occipital single. So at a frontal bone you pick up and then you tell this is the occipital. No, occipital is foramen magnum, foramen magnum. Okay. Now what I want to say is this: the vertebral, the foramen. Now your foramen transversaria, foramen transversaria, foramen transversaria. Okay. Now I have two malas here. You see. Now the spines even. Now this is the first cervical vertebra. These are the condyles that articulate with the occipital bone. Okay. Now there is a oval in the arch. This oval. This is the posterior spine. This is the anterior. Now this arch, it articulates the second vertebra. Okay. Now this is oval, this is even oval. This. Now this is odontoid process. Now the important is that, see, in any hanging, suicidal hanging or homicidal hanging. Now a suicidal hanging will, see, you don't take. Okay. Even I don't want to die, I want to live. Okay. Okay, we stand in the stool and then make fan, chunni, funni, jo bhi hai, rassi, laga diya, then suddenly you kick and immediately you die, because there's a fracture of this odontoid process, and that leads by medulla oblongata, and all the vital centers are there, and you immediately die. But if I hit poison injection or something like that, drugged, and then hang that person, that doesn't occur. Because when an anatomist or a jurisprudence doctor is not performing the killing, so anatomy समझ के इधर hit करना है तो, but टूटे कि ना टूटे वो कोई नहीं जाने. The muscles, neck muscles, see, when you go to the meat shop, you say that gardan, or you see balidan, offering to the different gods. Now the thick muscles, neck muscles. It doesn't permit. But over there, the muscle is quite this thing. But I'm telling you this: the vertebral, the bodies, the vertebral spine, the vertebral, the processes, the vertebral foramina is the uniqueness of the cervical bone, vertebra. Okay, and see, we have two sets here. পাঁচজন করে দেখে নেবে second cervical and first cervical. Then you see the other vertebrae are there, the foramina, and the spine, small, and it increases in size and then goes up to the seventh cervical, it's pointed. Then T1, T2, T3, T4, T5, T6. Got it? Please interact amongst yourself. See, there are skull is here. You try to articulate and see it for yourself. Unless you see it and observe. You have 1 hour. 1 hour at least. Next week, I will take random identification. Revision করবে, ফাইনাল রিভিশন এই ভেবে করবে আর নিজেদের মধ্যে পরীক্ষা দেবে।